Hello, everyone. Welcome to Lump Basics, or the Lump TCM and Acupuncture for Beginners. Let's welcome Sir Dino Pinheiro, Certified Associate Acupuncturist of Legazpi City, for the first presentation. Good afternoon, Sir Dino.
Good afternoon, Doc. Good afternoon po sa lahat. Now we go to the water element, deafness, hair loss. The treatment for deafness is mainly with local points. We use triple wormer 17, small intestine 19. These points are given deep with the patient opening his or her mouth wide and stimulated to create a strong needle sensation, then pulled up slightly so the patient can close the mouth. The needles are left in for 20 minutes. Having lived in England for the past 20 years, sabi ng author, I find that children in the West have more problems accepting needles than those in Asia. I have used laser in Western children with good results. We come to a compromise that I will needle only 2 points each time, with the rest given with laser. This is because I feel that needling is still a superior to laser. So we use points GB20, the most important point in the head, especially for sensory organ problems. Triple warmer 5 is an additional meridian distal point as the triple warmer meridian circles the ear. LI4, the area distal point, stomach 40 as a damp circulating point is added if the child has a glue ears or mucus-related problems of the nose and throat. Do 15, this is a dangerous point at the nape of the neck, but is invaluable in the treatment of congenital deaf mutism and was discovered during the time of the Cultural Revolution in the 1960s in China. Sabi ng author, I have seen many patients with tinnitus in these years. My rate of success in these cases had been 50 to 60%. Many of them improved, but not all were fully cured of their tinnitus. I've not been able to predict the results beforehand either. Sometimes a tinnitus of 10 years duration can disappear with one treatment. Sometimes an acute tinnitus will not improve at all. As a result, I treat every patient with tinnitus for 12 to 14 sessions anyway, and tell him or her that there is a 50% chance of a cure. According to my experience, sabi ng author, there are 2 main types and a 3rd possible type of tinnitus. So we have here another tower diagram, kidney deficiency. So yin ang deficient, normal ang yang. Liver yang excess and wind, there is an excess of yang, normal ang yin. And dampness in lung, so excess po yung damp. Deficient ang qi. Sa kidney deficiency, there is a constant tinnitus, could be like TB hiss or running water or pulsing. Does not affect hearing. Patient could miss high-frequency sound such as the ringing of the phone. Tinnitus is worst in the evening and nights and does not disturb sleep. Starts gradually with overwork and lack of rest. Patient could have backache, loss of head hair, and be easily exhausted. Next, the liver yang excess and wind. There is intermittent tinnitus, like a high piercing whistle, makes the person very nervous and aggressive. Affects hearing when present, hearing normal when tinnitus is absent. Tinnitus comes on at times of stress, usually good at nights and in bed. Start suddenly with stress and tension. Patient could be tense, nervous, and aggressive with hypertension and migraine-type headache, loud voice, and red face. Next, dampness in the lung. There is intermittent muffled sound as if one is hearing through an earplug, feeling as if the ear is blocked before tinnitus appears. Hearing and other senses, smell, taste, etc. are dull. Tinnitus worst in the morning on waking and if nose is blocked. Starts on and off with chronic recurrent nose, sinus, and throat problems. Patient could have an edema on face and eyelids, nasal voice, and mucus conditions of respiratory system. Okay, we continue with kidney deficiency. The points used is triple wormer 17, small intestine 19, which is the local point. Li4, triple wormer 5, the distal point. GB8 and GB20, symptomatic. Kidney 7 may be also used, yung lung 7. Tonify kidney yin, treat twice per week, then once per week. Next, sa liver yang, excess in wind, we use the triple wormer 17, small intestine 19, which is a local point. Li4, triple wormer 5, the distal point. We use GB8 for symptomatic. Do 20 tranquilizing. Spleen 6, descending technique. GB20, liver 2, wind sedation. GB38, sedation, to sedate liver yang indirectly and treat the patient 2 times per week. Sa dampness in the lung, triple wormer 17, small intestine 19, Li20, small intestine 17, and local points. Li4, triple wormer 5, the distal points. GB20, stomach 40, symptomatic. UB23, UB58, shoe of kidney, and lu of urinary bladder. This is also suitable for deafness following glue ear. Then we treat once per week. Next, we go to the kidney nourishes head hair. A good head of hair is a sign of vitality, and when the kidney energy decreases, the hair follows. The body hair is nourished by the lung and should not be confused with head hair. It is normal to lose some hair during change of season, especially as the weather becomes drier, but this is relatively little compared with the hair we regenerate. But if a person is going through a period of overwork, poor sleep, breastfeeding a baby, or in menopause, situations that drain our vital essence, they could lose hair at an alarming rate. The hair could also become thin, brittle, and dry. This is because the kidney yin is deficient and storage of nutrients is poor. Spleen blood deficiency, or because liver blood deficiency. Improved nutrition and tonifying kidney yin and liver blood will stop hair loss instantly. Okay? However, if one is losing hair from just one part of the head, the temples and the vertex are quite common areas. This may be a symptom of excessive heat and dryness in this area only. The 4 areas of the head. First, sa front, which is the stomach and large intestine, the vertex, the liver and pericardium area. Sa sides, we have the gallbladder and triple wormer. And sa occiput, we have the urinary bladder and the small intestine. We have already discussed, sabi niya, the 4 regions of the head in the section of the head. Associating these areas with different organs is also useful in problems of head hair and diseases of the scalp. Hair loss from the vertex. Local treatment. When there is some hair, 4 local subcutaneous needles in the area with continuous electrical stimulation. We use 10 Hz for 20 minutes, 2 sessions per week. When the patient is completely bald, plum blossom needle tapping in the entire area to cause bleeding. Done daily up to 14 days until small hairs appear, then electrical stimulation. Sa points, we use kidney 7 to tonify kidney yin. Treat liver imbalance, liver 5 blue point with GB40 sedation, which is the yuan source point. So here, fire heat in the liver area of the head, excess of yang. Advice against consumption of alcohol, excessive red meat, coffee, and other food that would increase body heat. Lung 7, which is the Lu point, tonifies yin and sedates yang. This point helps as scalps is part of the skin, and tonifying the yin of lung would tonify yin of the skin. Healthy looking hair. The appearance of head hair, whether it is bouncy and shiny or limp and dull, is dependent on the kidney yang and qi. Nowadays, we depend on many cosmetic products to achieve this look, and they actually make the hair worse over a period of time. But what seems to matter is the short-term boost, not long-term vitality. Hair is full of life in a person who has healthy sex life. Although a man would indulge in excessive sex and waste his kidney yin, which is the jing essence, could lose hair. Regular and moderate physical exercise also keeps the hair shiny and glowing. If the kidney yang is deficient, hair seems to go limp and dull. Next, we go to the premature graying of hair. Premature graying of the hair is a sign of kidney yang deficiency. Sabi ng author, I have been asked what is premature graying. Well, one gray hair before 35 in a woman or 40 in man, it has been observed that people would become gray in a day when subjected to a great fear or worry. If one feels trapped in a situation that creates fear or worry and can do nothing to escape from it, this can suppress the kidney yang and cause graying of hair. A simple but effective way to change their hair color back to normal, yes, sabi niya, back to normal color, is to do headstands for 10 minutes a day. Maybe this is not an ideal position for everyone, but one can lie on the bed and bring the head below the bed level and holding this position for 10 minutes. The idea is to send the blood to the head. Over a short period of time, within days, the hair color will change back to normal. So, i-try po natin, pababa po yung ulo. Gray hair usually occurs in certain areas of the head. The sides of the head are commonly affected. This is because the yang in these areas is weaker than the rest of the head. And this is a damp stagnation in the meridians. It helps to treat the meridian. For instance, if the sides are very gray, they would use point GB37, which is the Lu point, or triple warmer 3, the tonification point, to remove stagnation and tonify yang in this area. Thank you for your attention.
Thank you very much, Sir Dino. That was very helpful, especially for those who can relate to it. Okay, let's now proceed to the wood element. Okay, the liver opens to the eye. So we have here tower diagrams. So the first one is liver yang deficiency. And we have learned that this is a sign very common for nearsightedness or short-sightedness or myopia. So if one has liver yin excess and liver qi deficiency, there is long-sightedness or hyperopia. Okay, so with if one has cataract or turbidity of vitreous body, so one would look at a very deficient kidney and liver yin. For conjunctivitis, we have excess liver yang and lung yang. So it's like a deficient yin of the lung and liver and excess yang of the lung and liver for conjunctivitis. For puffy eyelids, so there's a lot of swelling, so there is increased retention of yin for the spleen, okay, and very weak qi. Now for iritis, the liver yang is increased. For glaucoma, the liver and kidney qi are deficient, and there is dump retention. And with astigmatism, there is kidney and lung yin deficiency. Thank you very much for your attention. Let us now call Ma'am Neats Galarita of Quezon City for wood element diseases.
Good afternoon, Dr. Hector. Good afternoon, everyone. We're on our 5th installment on the wood element diseases. So last time we have so many clinical examples of headaches. Today we have a new topic, which is epilepsy. In Sri Lanka, epileptic patients are quite commonly treated with acupuncture. They take few medications, mostly on phenobarbital. The treatment is very successful, and there are many patients who could stop medications and acupuncture treatment within 6 months. Though every patient is unique, the doctor here summarized the common imbalances in these patients. During a grand mal seizure, patients have convulsions and are unconscious. The liver wind seems to be high at this moment. One can use points do 26, the point at the philtrum, and kidney 1, which is at the sole of the foot. These are the revival points. So during epileptic seizure, we can use this point to revive the patient. And the fit will stop in seconds. The only time these points will not work is in a status epilepticus. This is a life-threatening medical emergency wherein seizures would last for more than 5 minutes. The main treatment is therefore to prevent the patient having a fit. This means that we need to tonify liver yin or liver blood during the interval between fits. So here is a tower diagram of how the liver yin and the liver blood, the liver yin and liver blood's condition progresses during epileptic seizures. First, we have here a liver yin deficiency where liver yin is deficient and liver yang is normal. So pag nagkaroon na ng seizures, still the liver yin is deficient and the liver yang rises. Or in liver wind pattern, here we have liver blood deficiency. It starts with liver blood deficiency with qi at normal level. So pag nagka-seizure na, the liver blood remains deficient and qi rises. So nagkaroon ng wind. So liver blood deficiency can cause liver wind to rise. Our liver yin deficiency can cause liver yang to rise. And this may generate liver wind. Although both reasons are possible, the diagnosis should be clear so that the correct energy balancing treatment is administered. So the doctor suggests that we differentiate between liver yin deficiency and liver blood deficiency symptoms so that it would be easier for us to decide what is necessary for the patient. So here are the symptoms of both liver yin and liver blood deficiencies. So for liver yin deficiency, it will manifest with dryness. Here we have gritty eyes with recurrent conjunctivitis and burning and redness. There is also recurrent tendon inflammation, contractures, poor extension, easy ruptures, poor healing, muscle pains, which are worst in activity, muscle tension, and difficulty relaxing. So in liver yin deficiency, there's also the tendency for yang to rise. So there is high blood pressure, spontaneous excessive bleeding during menstruation, or there could be nosebleeds, which have delayed coagulation, understension, and stress. Liver deficiency also presents with headaches during menstruation, and a tense person can be also aggressive if there's yin deficiency. There's also dry, brittle nails and nail bed inflammation. The tongue sides will be cracked and will have red papillae. The liver pulse will be deep and wiry, and the patient will be experiencing nervous tics and tremor vomiting. So in contrast, liver blood deficiency will have the following symptoms. The patient will be pale with a blurred vision, will experience dizziness or lightheadedness. The arms and legs easily go numb, and the numbness will improve with movement and weakness, and there also weakness of muscles. Liver blood deficiency will have the tendency for wind symptoms. So there will be nervous itching, sneezing, wandering symptoms, sound and light irritability, symptoms suddenly appearing, and there's long menstrual cycle with scanty bleeding. This also presents with headaches after menstruation, and the person will be weak, nervous, and irritable. There will also be bite nails and white patches on the nails. The tongue sides will be pale, and the liver pulse will be thin and hollow. There will also be inner tremor and uncontrolled upward staring of the eyes, and there will also be colic. So for treatment, for liver yin deficiency, we have to tonify liver yin, and we use the following points. We use liver 5, the low connecting point, gallbladder 40, and sedate kidney 7. Because in yin deficiency, often the mother is dry as well. So kidney being the mother of the liver. Water and salty foods are good because salt will help to retain fluids. So relaxation and meditation is also recommended, and we use also do 20 and pericardium 6. We use also it is also recommended to take fish oils, cream, and sweet and sour food, and avoid sour foods and alcohol. So for the treatment of liver blood deficiency, we have to tonify blood. Pag sa liver yin deficiency, we tonify liver yin. For blood deficiency, we tonify blood. So for this, we use bladder 17, which is the influential point of blood, and spleen 10, which is the sea of blood. In addition, we use REN 14, heart 9, UB 15, SI 3 to tonify heart yin and yang, gallbladder 39, which is the influential point of the marrow, and we use wind eliminating points, and also avoid sour food and alcohol. To tonify the deficiency in the liver is half the work done. The next half is to treat the heart, because if and when the liver wind ascends, it needs a place to flow to. If it cannot flow anywhere, it will remain where it is and increase. Normally, the liver energy flows to its son, which is the heart. As long as the heart yang is level, the liver yang has a place to empty its excess. Our work is to make sure that heart yang is not high. So we can achieve this easily by using tranquilization points and advising the patient to go to bed by 10 p.m. and not to get up before 7 a.m. And that is, have no break in the rest, no alcohol, avoid sour foods, working on a computer, and too much television. Okay? So how do we do this? We use the tranquilizing points, do 20, the extra point 6. This is also anion 1 or 2. This is also an extra point. And we use Bladder 62. And another point is do 26. And an extra point between thoracic 2 and 3. Liver yin or blood tonification. We also use liver yin or blood tonification points. Okay. If the patient is on medication, the treatment should be given at least 3 times per week at the beginning, from the 3rd week onwards, twice a week, from the 3rd month onwards, once a week, from the 6th month onward, twice monthly, and so on. When reducing medication, the patient could get some fits. In this case, treatment should be given more often until the body adapts to the change. Okay? Join us next time for another interesting topic on wood element diseases. Thank you for listening.
Thank you very much, Ma'am Lynn. We call once again Sir Dino Pinheiro of Legazpi for metal element. Good afternoon, Sir Dino.
Good afternoon, Doc. Good afternoon po sa lahat. We continue with the metal element, the concept. So we have the associated climate, dryness. Just as the heart and kidney share the heat and cold distribution, the spleen and lung share the damp and dry management of the body. There is a fine line between thin and thick fluids. If the thick fluid becomes excessive, we suffer various damp symptoms of the body and in the lungs and skin. The thin fluid becomes deficient. Not only is there general exterior dryness, but also the thick fluid becomes thicker, making it difficult to expectorate or disperse them out of the skin, creating the possibility for heat illness or inflammation. The climatic dryness affects the lungs and large intestine yin adversely. It helps damp illness of these organs. When patients complain of dry cough and thick mucus, it is useful to humidify the living rooms so that they inhale the humid air. When the skin is dry, they should use some simple moisturizing cream and a wet sauna. In both cases, they should drink more water and consume salt in their food regularly. It is very interesting to ask this patient to draw any picture that comes to their mind. The person with claustrophobia will draw an open space, forest, field, beach, etc. without any borders. Those with agoraphobia will draw a confined space, house, and garden with a thick fence, a picture with a broad border all around the paper, always highlighting the border or the frame. We go to the large intestine, the decoupled young organ. Between the lung and the large intestine, the latter is more active hollow organ. It is also more important eliminating organ. Problems of the large intestine must be taken extremely seriously and treated until well-being is restored. It is normal to have 1 to 2 stools per day. The stools should be well-formed and chestnut brown by certain foods. There should be no pain before, during, or after defecation. Abdominal distension is only normal after eating pulses, cabbage, or raw foods. Next, diarrhea. Diarrhea or watery stool could be the result of spleen Qi deficiency or imbalances of the small or large intestine. Spleen Qi deficiency has symptoms of its own. No hunger for breakfast, but around 11 a.m., tiredness after eating, heaviness of the limbs, lethargy, edema in extremity, etc. The watery stools are generally worse immediately after meals due to malabsorption. The stools will contain undigested food and be of lighter color than usual and rather frothy. Malabsorption diarrhea is a chronic symptom and can cause malnutrition over a period of time. It improves with eating cooked and warm foods in small quantities which are easy to digest. The small intestine has an important function of absorbing fluids. In both yin and yang dominant states of the small intestine, there will be a watery stool. So we have here a tower diagram, small intestine. There is an excess of yang or excess of yang deficient yin. So this is an acute Crohn's disease or appendicitis, colic, or severe intermittent pain around and below the navel, radiating to low back and thighs. There is urgent watery stool and wind relief pain for a short while. Coffee, strongly flavored foods, and activity worsen the pain and diarrhea. Resting, eating bland food makes the diarrhea better. Worst time is noon. Yellow, slimy coating on tongue color more red, and has a bad breath. Pulse, full, rapid, and slippery. So sa treatment, we use stomach 39, sedation, stomach 25, REN 12, stomach 37, sedation, and do 20. During acute pain, eat toasted white bread and clear salty soups, chamomile tea, and rest. Sa small intestine, there is normal yin, deficient qi. Chronic malabsorption syndrome, there is a constant dull pain around and below navel, dull low backache, abdominal tension, but cannot release wind. Black coffee or a little brandy could help with the pain and distension. Keeping busy, eating warm, cooked simple food helps the pain and watery stool. Worst time, night. White slimy tongue coating and pale tongue. Pulse is deep, slow, and slippery. Sa treatment, we use REN 8, moxa only. Sa points, stomach 28, stomach 37, and stomach 39. REN 12, UB 27. Always eat warm and cook small, simple meals, warm drinks, no raw food. With the large intestine, the symptoms is more often a yang dominant diarrhea, either due to colitis or irritable bowel. The stools are dark than usual with much wind and water. Sometimes also pus or mucus and stink. There is usually severe colic on either side of the navel, the left side worse than the right. There is anal pain while defecating. Symptoms may be recurrent and when bad several times a day and can cause dehydration. It is necessary to eat carefully during acute state, eating bland, simple foods such as toasted white bread and chamomile tea. Patients should avoid spicy flavored foods and coffee, food dried in oil, and large meals. When the patient has a chronic diarrhea with recurrent episodes, their large intestine yin is deficient and the yang increases from time to time when there is a reason for this increase. To prevent a bowel infection from turning chronic or in case of recurrent situation, it is always a good idea to tonify the large intestine yin. So the treatment points to treat large intestine yang excess diarrhea, stomach 25, which is the move point of the large intestine, which cools and calms the organ, tonifies yin. Sedate stomach 37, lower C point of large intestine. When sedated, sedates yang. And REN 12, the influential point of yang organs. Okay, we go to the lower C point. All perigens have their own 5 element points, which are called by names of water sources. The points of the finger or toes are the well points or the jing, and the points of the elbow or knee are the C points. The well points of the meridian are useful in the treatment of superficial diseases of the organ system, and the C points are used in the treatment of the organ itself. Points stomach 36, UB 40, GB 34 are all used in their organ dysfunction problems. All meridians flow on their respective organs, excepting for the three young meridians of the arm: large intestine, small intestine, and triple wormer. When treating the dysfunction of these three organs, their upper C points, LI 11, small intestine 8, and triple wormer 10 are not as effective. Therefore, additional points have been chosen on leg meridians and are used for organ symptoms. These additional points are called lower C points, as their meridians already have their own C points on the arm. So these points are the stomach 37, the lower C point of the large intestine, upper C point, LI 11. Stomach 31, 39, the lower C point of the small intestine, upper C point, small intestine 8. UB 39, the lower C point of triple wormer, upper C point, triple wormer 10. They can be used to improve the function of organs when applied as tonification and calm the function or disperse the heat when sedated. Thank you for listening.
Thank you very much, Sir Dino. Let's call once again Ma'am Lynn Galarita of Quezon City for the next topic, this time on body fluids. Good afternoon, Ma'am Lynn.
Good afternoon, Dr. Hector. Good afternoon, everyone. So we continue our discussion on vital substances. For today, we have body fluids, its functions, its disharmonies, and its relationship with other vital substances. So what is body fluids? Body fluids originate from food and drink. They enter the body by the stomach, which is said to be the origin of fluids. In TCM, we have here two concepts, which is chin and ye. Chin means anything liquid or fluid, and these fluids are thin, clear, light, and watery. It circulates in the exterior, that is the skin and muscles, with the wei qi. It warms and nourishes the muscles and moistens the skin and hair. Okay. Ye, on the other hand, means fluids of living organisms, more thick, turbid, dense, and heavy fluids. It circulates in the interior with the yin qi or the nutritive qi. It nourishes the joints and orifices, which means the eyes, the ears, and the mouth, and moisten the spine, brain, and bone marrow. So if you combine these two, Chinye is equal to organic fluids. Okay. So now let's discuss about body fluids disharmony. First up is body fluids deficiency. This can lead to a whole range of problems arising from lack of nourishing and moistening function. For example, deficiency of fluids in the intestines can lead to constipation. As for the clinical manifestations, we'll have dryness in the body, scanty urination, thirst, constipation, dry stools, dry eyes, and lips. And the tongue will be red without coating, and the pulse will be thin and rapid. Okay. Another disharmony is fluid retention. The main causes of this pattern can be the qi and yang of the lungs, spleen, and kidneys are too weak to transform and absorb body fluids, which could lead to dampness and phlegm. Among the clinical manifestations are poor appetite, fatigue, dizziness, edema, cough, damp with feeling of heaviness in the lower abdomen. The tongue will be wet with white coating and the pulse will be slippery or wiry. So now we go to the relationships between qi, blood, and body fluids. Okay. Qi is crucial in the production and the transportation of body fluids, and it is responsible for holding the fluids in place. So, kung impaired yung ating qi function, body fluids could leak. If body fluids become deficient, this can damage qi. The body fluids are essential for maintaining the health of qi. Okay. Body fluids and blood nourish each other, and body fluids are essential to maintain blood in good function. On the other hand, body fluids constantly replenish blood and makes it thinner so that it does not stagnate, causing illness. Okay. Thank you for listening.
Thank you very much, Ma'am Lynn.
Okay.
Okay, let's call once again Sir Dino Pinheiro for water element. Good afternoon, Sir Dino.
Good afternoon, Doc. Good afternoon po sa lahat. Now we go to the water element nervous bladder. This is a chronic state where the patient suffers from frequent, urgent, and lethal urination, which worsen when they are nervous. Needless to say, the patient is also very nervous. Symptoms are aggravated by young causes, such as after coffee or tea, less sleep or overwork, etc. We have here the clinical example of a female 23 years old. Sabi ng author, I saw this patient in a course of 20 medical students. The patient was also a student, and her problem was that she passed urine 2 to 3 times per hour. She could not go on any journey if there was no toilet on board for fear of an accident. If she went for a social get-together, she had to first find the toilet. And as long as she stayed near it, she could relax. The problem had appeared and worsened in the time she had been a university student. The urologist had investigated her and had suggested dilatation of the urethra. She was to have this procedure in 2 weeks. In the meantime, a friend who was attending our course had suggested that she try acupuncture. Sabi ng author, I noticed that the patient was pale and tired. I asked her how much water she drank. She said that she only drank coffee and tea more than 15 cups a day. She really needed this, or she felt very tired. It was quite clear that her caffeine consumption had increased through the years in the university, and so had the nervous urination. I suggested to her that I might be able to help her if she would give up drinking coffee and tea for 2 weeks. She looked bewildered and said, but what should I drink instead? Sabi niya, water, of course. She agreed as it was only for 2 weeks. We treated her 3 times per week for the next 2 weeks, at the end of which she passed urine only 5 to 6 times in a day. At the end of the 2 weeks, we sat down and explained to her how the bladder becomes hyperactive and irritated by excessive caffeine and alcohol, and that had been her problem. She slowly took it in and then asked if there was no compromise. I suggested that she could ration her drinks, 1 coffee and 2 tea per day, just when she needed them most. Now that her bladder was not the problem, she could do some sports. This would help her energy level. Nervous bladder, the urinary bladder, there is an excess of yang, deficient yin. Nervous bladder would not be confused with frequent night urination. The latter worsen at night and disturbs sleep and is a kidney yang deficiency symptom. Nervous bladder is worst when the patient needs to go out or when they are excited. It is better at night when they are asleep. So sa treatment points, run 3, Move front point of the bladder, cools and calms the bladder. Spleen 6, the area distal point. Kidney 4, the loop point of the kidney, tonifies yin and sedates yang. UB40, the earth point, grandmother point of the UB, tonifies yin. Do20 liver 3, tranquilizing point and point against nervousness. Kidney makes marrow. Marrow is the substance of the bone or the bone marrow and the brain and the nerves brain or nerve marrow. This substance is associated with the kidney yin. Symptoms such as fractures and caries in teeth showing weakness of bone marrow or osteoporosis, and nerve atrophy, Alzheimer's disease, multiple sclerosis showing reduction of nerve marrow are examples of kidney deficiency. Symptoms such as stiffness of joints and edema in wet and cold weather and hydrocephalus indicate yin excess. Arthritis, osteoarthritis, backache, neuralgia, paralysis are all problems of bone and nerve marrow. Muscles and tendons are associated with the liver. Therefore, a pain or problem relating only to muscles and tendons should be treated in the liver meridian. Skeletal pain needs to be treated on the kidney meridian. Pain in the joint should be treated on both kidney and liver meridians. Thank you for your attention.
Thank you very much, Sir Dino. Let's call once again Ma'am Lynn Galarita for the meridian theory. Good afternoon, Ma'am Lynn.
Good afternoon, everyone. Today we continue our discussion on the Ren meridian. We all have already learned how to locate the different points along the Ren meridian. For today, we discuss about the significance of the signs we see as we observe and palpate along the meridian. Okay. So in general, there are no special considerations for observing the Ren meridian. So as to pulse palpation of the areas related to the Ren channels, the first pulse to consider is CV12 or Ren 12. Deep to this point, one can find that deep to this point, one can find the descending aorta. When palpating this area, the pulse should generally be difficult to find. So if there is a strong pulsing at CV12, known classically as pulsing beneath the heart, this most often indicates a condition of excess in the spleen and stomach. CV12 is also the front view point of the stomach. So another pulse significance can be found at CV6. This pulse should not be felt at all on the surface and should be flexible but noticeable at the middle and deep levels. A very firm and strong pulse at CV6 generally indicates cold or stagnation in the lower burner. Weakness at the CV6 pulse indicates kidney deficiency. Okay, so let's start palpating the Ren meridian. Okay. Tenderness is often found at CV21 when there is inflammation in the upper respiratory tract. If there is tightness or a tendency to spasm around CV14, this may indicate problems with the diaphragm that can present as heart-type pain. Softness or tender nodules found in the area of CV13 or CV12 may indicate chronic stomach problems, often gastritis. In such cases, there is often a lack of proper ascending and descending by the spleen. Lack of proper transformation over time leads to dampness, and possibly heat accumulation that can be palpated in the area. Okay. So here we have an illustration where the CV21 point is located. CV14, which is around 6 tune above the umbilicus and 2 tune below the sternocostal angle. Okay. Hardness felt around CV11 and CV10 may indicate heat in the middle and lower burners. Symptoms might include a stomach or duodenal ulcer, or inflammation of the intestines, which could be colitis, diverticulitis, or Crohn's disease. Tenderness or mild swelling around CV6 or CV4 is often seen in gynecological conditions, bowel or urinary problems caused by accumulation of cold in the Ren vessel or the womb. If pain is very severe at any of the Ren vessel points, it is not advisable to needle in the area. Instead, one should consider downstream points on the 3 yin channels of the legs, especially the cleft points, to help drain accumulation in the channel. Okay. So, to summarize, if you can feel soreness in CV21, this means there is heat in the lungs or the upper respiratory tract. If there is a strong pulse in CV12 to 13, this means an excess condition affecting the spleen and the stomach. If you could feel hardness around CV10 and 11, this could mean heat in the middle and lower burners. And also, if you could feel softness or weakness, this could mean chronic problems of the stomach and low-grade inflammation due to spleen deficiency. Okay. So around CV6, if you could feel soreness, this could mean cold stagnation in the Ren vessel or the womb. And if there are nodules, this could mean cold phlegm in the lower burner. Upon palpation, if there is a strong pulse around CV4 to 6, this could mean cold stagnation in the lower burner. If there is hardness, this means chronic lower burner stasis. Okay. Weakness naman ang ating mapapalpate. This could mean kidney. Thank you for listening.
Thank you very much, Ma'am Lynn, for the presentation. We now come to the last presentation for this afternoon. Chronic fatigue syndrome. So we have a case history, not of CFS, but of chronic mouth ulcers. So this is presented here to give us an idea about the nature of yin fire. So we have a 52-year-old woman with recurrent mouth ulcers, and the mouth ulcers came in crops and were very painful. They had a small yellow crater around them. The most painful ones were on the tongue. The most common pathology of mouth ulcers is heat or empty heat of the stomach, large intestine, heart, or kidneys. This patient had been invited to have a meal in a Sichuan restaurant where they use very spicy food at a time when she had an attack of mouth ulcers. And knowing something about the Chinese diet, this patient was dreading it as she thought that the spicy hot food would make her mouth ulcers much worse. She did go and have this meal, and to her amazement, the next day, her mouth ulcers were much better. So explanation, mouth ulcers were not due to heat or empty heat, but to yin fire. As this fire is due to deficiency of original qi, the spicy hot foods had actually tonified the original qi and the true minister fire, and therefore indirectly subdued the pathological minister fire. They indeed brought the minister fire back into its normal place of concealment in the lower burner. To summarize, 4 factors can give rise to chronic fatigue syndrome. A residual pathogenic factor, which is usually dampness, after invasion of an exterior pathogenic factor. Second, latent heat. Third, a pathogenic factor lodged between the exterior and interior, that is, a lesser yang pattern, and yin fire. Now let's go to deficiency. In addition to the above 4 factors, in CFS, there is always an underlying deficiency of the body's qi, and this favors the formation of latent heat, a residual pathogenic factor, or of yin fire. Deficiency may be of qi, yang, blood, or yin, although deficiency of qi is the most common. The organs involved are mainly spleen, lung, liver, kidneys. Of this, the spleen is the one that is most commonly involved. In the development of latent heat and yin fire, a deficiency of the kidneys is particularly important. In latent heat, a person is subject to an invasion of wind without developing acute symptoms. The pathogenic factor penetrates into the interior, it lurks inside, and emerges later as latent heat. The reason for this pathology is primarily kidney deficiency. The Yellow Emperor's Classic of Internal Medicine introduced the idea that if one does not guard the essence in winter, latent heat will develop in the spring. Interestingly, with regard to CFS, an American study reported abnormalities in cortisol levels in a group of 30 chronic fatigue syndrome sufferers. They had a mild decrease in blood cortisol levels. Low levels of cortisol alter the immune function to allow exaggerated allergic reactions and the reactivation of dormant viral infections, which is the latent heat, such as Epstein-Barr virus. In Chinese terms, that confirms that a kidney deficiency, as cortisol comes under the influence of the kidneys in Chinese medicine, kidney deficiency is the basis for the development of latent heat. So we consider the essential manifestations of true CFS to be in 4 main groups: pronounced muscle fatigue and ache, poor memory and concentration, exhaustion, persisting, intermittent, general flu-like feeling. So here we have a diagram showing to us the cortisol levels and kidney deficiency in CFS. So for patients with kidney deficiency, there will be low cortisol levels, and this reactivates a dormant viral infection, which results in the formation of latent heat, therefore resulting in post-viral fatigue syndrome. Thank you very much, everyone, for joining, and we hope you can join us again in the next one. Thank you so much.